hot topic for today is face sculpting. The concept of introducing active ingredients alongside suspension garment or other sort of garment on the skin surface does have some merit. For example, the high performance eye mask that I created is kind of like a garment that you're applying temporarily to the skin to deliver active ingredients. But what's the difference? The difference is if we're utilizing a material that we've proven delivers active ingredients to the skin, then you're actually augmenting or improving active ingredient delivery. And this is wonderful. And that's why the eye mask is so powerful in replacing the need for procedures. Typically, it does need to be a hydrated garment or a hydrated piece of fabric in order to make good contact with the skin and for the active ingredients to be able to penetrate. In the absence of any sort of liquid format, if you're talking about a dry garment, the chances of those active ingredients actually penetrating to the skin is much, much less. Where we're lacking evidence is to whether these types of suspension garments should be worn on a regular basis as a preventative treatment. So for example, a sling in the neck is great post-liposuction, which is a procedure I've performed over the years, but it is unclear as to whether the net benefit of using it on a nightly basis. And why wouldn't it be of benefit? Well, it depends on the garment, the level of constriction, and you also have to be concerned about the negative aspects of wearing a constriction garment on the face and neck that may not be predicted until after it's been worn for quite some time as to whether it has any adverse consequences. These fabric suspension garments for the face and neck, how do they feel and how will they perform? There are a couple things you have to be concerned about is the level of constriction. The other is, does it fit perfectly to your face? Are you going to get bunching up? Could it introduce new wrinkles through the fact that the fabric is bunching up? These are all very important questions. To actually work, this would have to be perfectly applied to the skin, and it would have to be done in concert with sort of wound healing or some other regenerative mechanism in order for it to train your cells, to train your skin into healing smooth treatment. Hopefully this is helpful to you in making that decision.